Brown rice gets praised as a diabetes-friendly food, but the truth is more complicated than most people realize. Brown rice does offer advantages over white rice because it keeps the bran and germ layers intact. These layers contain fiber that slows down how fast your body converts carbohydrates into blood sugar. This slower process helps prevent the sharp spikes that damage blood vessels and organs over time. However, brown rice still contains plenty of carbohydrates that will raise your blood sugar levels. The glycemic index of brown rice sits around 50 to 55, which is moderate, not low. White rice scores around 73, which explains why brown rice performs better but not perfectly. Your portion size matters far more than choosing brown over white rice for blood sugar control. Eating 2 cups of brown rice will spike your blood sugar just like white rice does. A better approach involves eating 1/4 to 1/2 cup of cooked brown rice per meal. Combine that small portion with lean protein like chicken or fish, and plenty of non-starchy vegetables. This combination slows digestion even further and provides balanced nutrition without extreme blood sugar swings. Always check your blood sugar 2 hours after eating brown rice to see how your body responds. Some people handle brown rice well, while others need to limit it more strictly based on their individual response. Brown rice can fit into a diabetes diet when you control portions and pair it with protein and vegetables.